most MIGS fellowships are really laparoscopic robotic fellowships. And so our decision to start doing it had to be very systematic and safe, and we had to have the right people in the room, and having commitments from both UroGyn and MIGS is a great way for both divisions to improve their skill set, to be able to do more, and everybody wins. But it's been nice to have that partnership. But it is something that I think vaginal surgery and colpotomy is a bit of a lost art for some of us.
Yeah, it's always a huge advantage if you can start with more than one person in the department, go to the training together, go and observe with somebody with experience together, and then it's just easier to be two to get started. It's safer for the patient. I think that's exactly what happened over the years. Is teaching vaginal surgery, we're a bit less comfortable doing it because we don't see everything so well. But it's definitely a whole lot more difficult to teach vaginal surgery than to teach laparoscopic surgery because of that visualization issue. And I think with vNOTES now, it actually becomes easier to teach vaginal surgery again, because now you can see endoscopically what your assistant or your registrar, whoever you're teaching, is doing. So I'm hoping we're going to broaden the teaching of vaginal surgery again with this.
Yeah, it's when you get in there and see it, it is pretty incredible to watch, and you go, okay, that makes sense. I think there's going to be part of that learning curve is visual cues, and there's certain things I look for. Your brain just notices things when you do hundreds or thousands of cases. And that's something that will just take time from a different approach. But I think that's something, it does take a commitment to doing a lot to get good at anything, especially a new surgical approach. Aside from cosmesis, what are the benefits that you've seen and that we're finding out that happen for patients when it comes to vNOTES, and maybe also for physicians?
So the obvious thing is we're making no abdominal incision. So, aesthetically, I think for us as surgeons, that's a minor argument. I think we deal with a special population. We're just dealing with women, not with men. So I think in our population, it's more important than in the general population. I mean, we notice amongst patients, as a man, I have a knee injury and I'm in the locker room playing basketball and I can show my big scars to my mates. I feel like a big man. But for the female population, it is more important not to have any scars. But I think for us as surgeons, that's not a major argument when we're actually deciding which procedure to choose, and we want to choose the safest procedure for our patient. I think we've done 2 randomized controlled trials comparing vNOTES with laparoscopy, one the Halon trial for hysterectomy and a second one notable trial for adnexectomy, where we did in a single center blinded setting, a non-inferiority blinded setting. We compared the 2 techniques, and the clear significant outcomes were, well, one, it was a non-inferiority trial, so it was non-inferior. We had no more conversions in either group, but I think the more important ones was pain. So the postoperative pain scores were lower in the vNOTES groups, and the use of analgesia was lower. We had shorter hospitalization time, and one of the outcomes was discharge within 12 hours, and that was significantly higher in the vNOTES group than in the laparoscopy group. And we had lower complication rates in the hysterectomy group as well. But that's, single surgeon, single setting. So we're looking now we're starting a multi-center randomized controlled trial comparing vNOTES hysterectomy techniques. So laparoscopic hysterectomy, vNOTES hysterectomy, and vaginal hysterectomy. There's no good comparisons at the moment between vaginal hysterectomy and vNOTES.